Hello, doctor.
Hello, my dear Arda.
I want to start with the first question that just came in. Of course, the client is asking, in cases of tooth loss, should they choose a bridge or an implant?
To explain this or to make a choice, we first need to clarify what an implant is and what a bridge is, my dear Arda. A bridge is used to address the gap when one or more teeth are missing in our mouth. For example, if we have one missing tooth, we grind down the neighboring teeth on the right and left. We create a crown with 3 members and bond it to that area. So what are we doing when we choose a bridge? We cause about 30 to 40% wear on the neighboring teeth, which harms those teeth. We prefer not to harm the neighboring teeth as much as possible while performing the procedure. What does this require from us? It requires an implant. What is an implant? An implant is a titanium screw that is placed into the bone to fill in the gaps when there is a loss of one or more teeth. So after these explanations, what should we prefer first when there is one or more missing teeth? We should prefer the implant.
Our reason for preference is primarily the implant.
Of course, when do we not prefer an implant? However, if the bone tissue is not suitable or if there is any kind of complication. What does that mean? For example, our patient is receiving chemotherapy and his oncologist. They have said that should avoid surgical intervention. In such cases, can prefer a bridge instead of an implant. What is another area where a bridge is applied? For example, we have 3 teeth and one of them needs to be extracted. Our 2 neighboring teeth have serious overhangs. Their fillings are huge and there's decay inside. They also need to be restored. So in such cases, we can also prefer a bridge. So, when we are going to perform a treatment, we primarily prefer implants about 80% to 90% of the time, meaning that in cases of tooth loss, we choose implants as much as possible. In some specific situations, opting for a bridge is an option. For example, our patient has an old bridge. This bridge needs to be renewed. Such situations are also an alternative.
As I understand it, the bridge application is somewhat due to necessity, meaning in situations where an implant cannot be done.
Exactly. You summarized it very well, my dear Arda.
Thank you very much for the valuable information you provided, doctor.
You're welcome, Arda.
See you in our next chat about the next tooth.
See you later. Don't forget to subscribe to our channel and follow me. Looking forward to seeing you.